Hey guys, Fauquier Health is here this month. We're really excited to be able to kick off February for Heart Month. I'm really excited to introduce you all. We've got Dr. Shah with us, cardiologist, as well as Lucy Mumo, who's our Director of Dietary Services. We're starting a program here at the hospital, very educational, healthy plant-based dieting program to hopefully help with our cardiac patients that are coming in with their recovery, as well as kind of giving them the tools that they need when they go home to lead healthier lifestyles. So I encourage you all to listen in, and happy Heart Month.
So my name is Lucy Mumo, and I'm the Director of Dining Services here at Fauquier Hospital. And I'm really in charge of making sure that whatever the doctor has prescribed for the patient is what we actually deliver to the patient. So our goal is to provide the services to our providers to make sure that what they want, they would like for their patients is what we are actually delivering at the end of the day. Our goal is to make everything from scratch. So we want to bring in our fresh vegetables, we want to bring in our fresh meats. Whatever we can bring in that's fresh, we will make it fresh. So most of our foods, anything that you eat here will be all made from scratch. So that's our goal. We love it especially when we hear that people are interested in more fresh foods and more fresh items. We get even more excited because this is what we are all about. So it's very encouraging to see physicians that want to do something different. A lot of times we find physicians will wait in their office for patients to come in, and they will prescribe the medication, but not really working more towards the preventative side of healthcare. So when we find physicians that are willing to do something different, do something that's not your regular, what your regular doctor will do, it's very exciting. And so when Dr. Shah reached out and said, we're thinking about, doing a different kind of diet to help our cardiac patients, we were very excited to jump in and work with him and see what we can do to partner with him to get this program rolling.
So my name is Dr. Neel Shah. I'm a cardiologist with Carient Heart Vascular. We're a large group of cardiologists from Vienna to Warrenton to Woodbridge, all over Northern Virginia. I'm home here in Fauquier County. I've been here about 6.5 years now. So I love working in Fauquier County. The number one reason is the patients here. They're so friendly and easy to get along with. They really genuinely have a deep respect for all of their healthcare providers, and it just makes each encounter with a patient so much more pleasant. It's been a great privilege to really serve the community here for the last 6 years. So heart disease is the number one killer of mankind, and it in many ways is a preventable disease. We know that the largest source of cholesterol and inflammation in the body comes from the food that we eat and the lives that we lead, the way that we live our lives. And nutrition is so foundational to that. And what we're trying to do is help folks understand that there may be better ways of having a relationship with food so that we minimize the cholesterol that we add into our bodies, and we minimize the inflammation that comes into our bodies from the food that we eat. So what's been shown over the last several decades through scores of research studies is that following a largely plant-based diet with foods that are minimally processed is a way of a relationship with food that number one helps prevent plaque buildup inside the arteries of our body, and if we already have plaque buildup in the arteries of our body, it helps to arrest and reverse that process. there's been some remarkable stories. I have a patient who had been on insulin for several years, and within about 6 months of eating a plant-based whole foods diet, is no longer requiring insulin for his diabetes. These stories, sort of go on and on with respect to how changing your relationship with food and your lifestyle can reverse high blood pressure and heart disease and so many of the other chronic diseases like diabetes. So when a patient comes to me and asks about how they can minimize their risk of heart disease, it begins by having a conversation with them and seeing where they are now so that we can understand how their relationship with food formed. Your relationship with food forms when your parents give you your first bite of oatmeal or cereal, and then it grows from there. So when you talk to patients and we talk to them about changing that relationship with food, you're really pulling at heartstrings that go all the way back to their earliest memories of childhood. So it really requires a conversation that takes time, and that happens over several office visits. And in that process, we start by understanding where they are. And I go through, with each of my patients, go through some of the scientific studies that show us how food affects inflammation and plaque buildup in our arteries. And I tell them that these are some of the ways that people and populations around the world have eaten, and this is how they've been able to lead lives without such a high risk of heart attack or stroke, or even certain types of cancers that are related to obesity and lifestyle. So, and once I show them that, I give them resources. So there's plenty of resources on the web, through books. If you walk into my office, I have books that people can look at in the waiting room, and I show them websites. Forks Over Knives is a wonderful resource and website. Dean Ornish, Dr. Neil Barnard, they have wonderful websites with the Physicians Committee for Responsible Medicine. So I point them to these websites and resources, and I have them just take a week and look at all the resources and educate themselves, so they have a fund of knowledge so that they understand how their relationship with food. In many ways, food is an addiction, especially to unhealthy foods. And just like any other addiction, sometimes there has to be a period of abstinence before you can sort of reconfigure your mind so you're not dependent on that substance. And so what I tell them is, see if you can, for a week, go through your pantry, go through your kitchen, and see what foods that you can make that would be your breakfast, your lunch, your dinner, and your snacks. And then over the next 2 to 3 weeks, see if you can just eat those foods and see how you feel. And some people love it right away. Other folks, will see that they can do it, but they want to go back to eating what they have been for 1 or 2 days of the week. It's okay. There's many shades of gray here, and we know that about 85% of all of the chronic disease that we see, so much of heart disease, so much of diabetes, and stroke risk is entirely preventable. And so there are certain folks that, due to COVID and due to the severe psychological impact of that, they've gotten into very unhealthy eating habits, and they're using food as medicine, but not in a good way. They're using food to help lift them temporarily, albeit out of depression. But on the other end, we've seen some folks that with that extra time, they've kind of begun to look at how food affects the immune system. To start, the best way to prevent COVID infection and serious complications from COVID is to get vaccinated. But we know that folks that have healthier immune systems are going to have a much better outcome to not only COVID-19 infection, but to any other infection that comes along the way. And so we consistently see across studies that when you eat a plant-based whole foods diet, and with foods that are minimally processed, your immune system is much stronger, your inflammatory markers diminish significantly, and we see significant inflammatory diseases diminish and fall by the wayside. And so patients have been Googling this, and they come in and they say, hey, I know you told me about this for my heart. I didn't know that it could have this impact on my immune system. And so that's been really rewarding to see that patients themselves are finding the information. A wise fellow physician told me, you'll never actually change someone. We say that we like to kind of help somebody change their behavior, but really you're just bringing them all the information, showing them the options that they have, and until they're ready, that change will not happen. And so it's nice when it's initiated by the patients themselves.